Today we talk about elastic impression material. In the previous two lectures, we talked as a general in detail about a rigid impression material, zinc oxide eugenol paste and impression compound. While from today, we will in detail discuss the elastic impression material. And by the way, the ideal impression material for intraoral detection, normally and abnormally, it is an elastic impression material. Why? Because it can be removed from the undercut area without tearing and return it back to original form without any distortion. What do you mean by it? When you have undercut case, when you take impression by rigid impression material, it can cause tearing of the material or can cause injury to the tissue. While in elastic impression material, you can take impression without any deformation. Why? Because it has own elastic properties. By the definition, an elastic impression material, it can transform from the semi-solid, non-elastic state to a highly elastic solid state. What do you mean by solid? In the origin, elastic impression material, it is non-solid, while after reaction, it can reach to the solid state. Types of impression material. We mean elastic one. Two systems you use it, either hydrocolloid or elastomeric material. Hydrocolloid or elastomeric material. By the way, what do you mean by hydrocolloid? Those materials that react by the presence of the water. It is an elastic material. While elastomeric material, it is reacted without presence of the water in the reaction. بس يعني as a general, number one, number two, شنو difference between them? Number one يحب الووتر، يحب الماء. الثاني ما يحتاج ماء على مود الرياكشن. But both of them it is elastic impression material. أنا ما أدخل بالموضوع شنو reaction مالها، هذا كيميكالي هذا فيزيكال ها؟ لا بس by the way both of them is elastic material, but one of them it يريد الوتر على مود الرياكشن، الثاني واحد ما يحتاج. بس واضح؟
نعم دكتور.
تمام. Elastic impression material. Number one, hydrocolloid, as we say. For example, agar impression material or alginate. Both of them, it is hydrocolloid, but both of them, it is elastic impression material. While elastomers, it's like polysulfide silicon and polyether. rubber base لكل العيادات موجود هذه المادة. But the polysulfide and polyether not available. Why? Because it is due to the high cost. While for the silicon you have Alamutici, all of the dentists shifted to silicon. we have two types of silicone. Additional silicone, we say it as abbreviation A silicone or C silicone. As in detail, we can say it is a condensation type silicone. Two types of silicone. In the later lectures, we talked about it. Don't hesitate yourself. Okay. This is the rubber impression material. While this one, it is alginate. It's hydrocolloid. Why it is hydrocolloid? If the particles are suspended in water, the suspension is called hydrocolloid. تمام؟ لأنه البارتيكل مال الألجينيت must be suspended, mixed with water. That's why we call hydrocolloid. We have types of hydrocolloid based on gel reaction. We have two types of hydrocolloid, either reversible hydrocolloid and irreversible hydrocolloid. Reversible hydrocolloid, like what? Like agar-agar. Agar-agar, it's changed from gel state to a solid. من الجل to a solid. By what? By the physical change. When you heat, it changed to solid from gel. When remove the heat, it returned back to a gel. Another definition, by heating, change from gel to solid. By cooling, change from the solid to gel. Okay, this is the first impression material discovered for taking intraorally in dentistry, by the way. But now we cannot use it, replace it by a new generations of impression material, like rubber impression type. Why it is not used today? Because it required too much expensive instrument and equipment. Like what? Special type rim lock tray and an equipment for heating of the material. The material here, after heating, will come here to the tray, like this line. Here it's clear. This is the impression agar-agar. This ulba, this is the tray, or sometimes you can use it for duplication. And by the way, it needs high electrical voltage, equipment, instrument, and time, and the taste of the material, it's not good. That's why not used nowadays. The uses of agar-agar, it's widely used till now. It is for duplication. What do you mean by duplication? Copy and paste. When you need to cast for the same patient, we need agar-agar for copy and paste. واضح هسه number 1. Number 2, for full mouth impression, but without deep undercut, but today not use it for taking impression. Why? Because of the previous reason we talked about. And in the past, use it for crown and bridge, but due to the elastomers, now it not use it. Number 4, it is used as a tissue conditioner, but now it's not used. And the main use for cast duplication. That's all. Usually supplied, and it's available in as a gel in a tube for taking single impression, or it's available in a glass jar. It's available also in a bulk container for duplication. The second type of hydrocolloid is irreversible hydrocolloid. Why it is irreversible? Because it is changed by chemical reaction. Like what? Like alginate, the most widely used material in the world. The change by chemical change from sol to gel. After chemical reaction ended, it cannot be returned back to a sol. Why? Because it is a chemical reaction. That's why it is a reversible hydrocolloid. What do you mean by hydrocolloid? Because it consists of particles of a colloidal state in a water. Water, usually, it's a prefix of what? Hydro. Hydro, it means water. Colloid, it means gelation. Irreversible, because it cannot be returned back to original shape. Available is a powder. Available, a powder, either in bulk container, tin or sachet, or a pre-weighed packet for single impression. Imma available in a container containing the material or a single impression. Sometimes available in color change in alginate, yani during reaction, the change of the alginate will, the colors of the alginate will be changed. What do you mean by this color change? It tells us the types of the reaction. How, if when you mixing, the color will change to violet. During seating to the tray, will change to pink, while the material set the end reaction, it changed to white color. White color. This is the bulk container. Number 2, it is a chromatic alginate. It is a color change. يعني بالcontainer sometimes contain no any color change, but if you written like this, it's a chromatic alginate. It means it changed the color by the reaction. All of the detail present in the packet, like this. Mixing work time, الsetting time is get, كل شيء موجود. الchromatic, it is a color change. If written down non-chromatic, that means the color not changed by the reaction. Okay. Usually for taking impression of alginate, we need rubber bowl, spatula, plastic cylinder for measuring of the water, and plastic scoop for measuring the powder of alginate. Okay, this is the component of the alginate. Potassium alginate, calcium sulfate, potassium titanium, chloride, zinc oxide, diatomaceous earth, sodium phosphate. For both of them, we have the function and the weight percentage. The most important one, it is diatomaceous earth. It is 60%. The certain reactions of alginate العفو الجدول أني بس أريد الفانكشن والكومبوننت.
يعني الوزن مالته ما تريده؟
لا أنا ما أريد الوزن. شنو استفادة الصوديوم فوسفات بالكومبوننت of alginate? It's a retarder. شنو material that act as a reactor in the alginate? We can write down it's a calcium sulfate. تمام. Okay, the certain reactions of alginate. First of all, you have sodium phosphate. It's a reactor, retarder. React with the reactor calcium sulfate. Okay. The calcium sulfate react with the remnants of the sodium alginate to form calcium alginate in a gel form in the presence of the water. This is the main reaction. This is the reaction. You have two types of alginate. Type 1, fast setting. Type 2, normal setting according to the color. Okay, for the mixing time, 45 seconds for type 1, 1 minute for type 2. While working time is different, but the setting time for both of them the same, 1.5 to 5 minutes. If you overmix it, alginate, the reaction will change. The first of all, the strength will decrease it. If you overmix it, the working time, the same, will decrease. You have another term. If you undermix it, what will happen? Inadequate working time. The reaction can cause non-homogeneous, and the strength will decrease. The mixing can cause grainy, and the detail can cause in poor production. How you control the gel time? You have two types of control. You have one control by the manufacturer from the معمل by the amount of retarder added during manufacturing, or sometimes you can control by the clinician. What do you mean by clinician? It is you. The dentist can control the gelation time. How? By changing water powder ratio, by changing mixing time, and by changing the temperatures of the water. Okay. If you increase the temperature, it can cause decrease the gel time. And if you use a cold water, the gelation time will increase. Okay, premature gelation can cause distortion. Okay, prolonged gelation, when you increase the time of gel, it is useless for both patient and the dentist. Why? Because the patient cannot accept the too much time when you take in the impression, and the dentist cannot tolerate too much time spent by the patient because he or she during the clinical time has no time for taking impression. He or she need to take impression as soon as possible. Why? Because of the another patient. The ideal dilation time is 3 to 4 minutes in 20-degree at room temperature. Okay, for taking mandibular impression, 2 scoops of powder and 2 scoops of water. While for maxillary impression, we need 3 scoops of water and powder. The properties of alginate according to American Dental Association specification number 18, taste and odor, it's pleasant, it's acceptable. The flexibility, it is about 50 degree, 14 degree at the stress of 1000 gram per centimeter cube. Decrease the water powder ratio usually decrease the flexibility. Elasticity and elastic recovery of alginate, it's highly elastic. The change will about 1.2 percentage. It is acceptable for impression. The reproductions of the detail lower than agar-agar. The strength is about, we have 3 types, compressive strength, tear strength, but usually tearing will occur in thin section. Factor affecting alginate gel strength. When you have مجموع الأسباب, it will affect the strength of alginate. What are the factors? Number 1, water powder ratio. Too much water powder, too little water powder ratio. From both of them will affect the gel strength. Mixing time, increase mix, decrease mix, it can cause reduce the strength. Time of removal of the impression. If you delay it intraorally a few minutes, it can cause increase the strength during removal. Number 6 is we have 2 terms, syneresis and imbibition. Both of them affect the dimensional stability. When you remove the water from the alginate, it can cause shrinkage of the alginate. This term we can call syneresis. When you take impression and insert into the water, it can take the water. This term we call imbibition. Both of them, it is a bad effect the quality of impression. Both of them affect the dimensional change. How you avoid this phenomena? It must be put the impression immediately after taking the impression, after remove the impression from the mouth. Number 7, biological properties. Usually, silica presence in the alginate. It can hazardous to the GIT system. That's why you can use alginate, but the dentist must be covered by the mask. Sometimes you have dustless alginate. It contains glycol instead of silica. It cannot any effect to the breathing system. adhesion, alginate usually does not adhere to the tray. That's why either the retentions of the alginate to the tray either by the mechanical perforation of the tray or by application of the special types of adhesive must be put it on the tray before taking impression. The shelf life and storage, العمر المال alginate, when you increase the temperature at humid environment, it can affect bad effect of the shelf life and storage of the alginate.